And in India, it is out-of-pocket payment system. In India, anyone who is getting a health service has to pay from his own pocket. Okay, and it is also government funded one, in which the government hospitals are completely free. It is government funded, and the privates are out-of-pocket payment in India. And in Germany, it's universal health care. It means each and everyone should be insured compulsorily, and from your salary, the uh, say if you are earning more than 63,000 euro per year, then you are allowed to change it to a private insurance. If not, you are mandatorily added to the government or public health insurance. So, as a physiotherapist, we are average earning around 38 to 40,000 euro, 40,000 euro per 45,000 euro up to that per year. So, we are mandatorily public health insurance insured. And if you are really owning your own clinic, if you are becoming a self-employed, and then you can choose, even if your income is less than 30,000 euro, you can choose to go to private. So that is the basic thing about public and private insurance. And as a healthcare provider, how do you get paid in Germany? Well, when you give treatment to a patient, let's say you are a patient, you are visiting a physiotherapist in Germany, and how do you pay for the physiotherapy services? It means that you should have a, let's say a prescription from a doctor or an orthopedician or a neurologist to visit a physiotherapist. And in the prescription, it will be mentioned a certain number of settings, like 6 settings, the common settings, 6 prescription or 6 sessions is a common prescription every or most of the patients get from a doctor. And in that 6, you may have to pay only the first treatment. That is around, let's say the first physiotherapy session is 26 euro. Okay, and 26 euro you have to pay. Additionally, the 26 euros only, the 16 euro is the fee for the initial treatment, and 10 euro is the additional receipt fee. Receipt give you. I mean, I'm thinking about in German, I'm translating in English, so it is taking some time. So receipt fee is 10 euro. And then you get all the rest of the 5 treatments for free. This is the how you pay for the physiotherapy sessions in Germany, and how the employers who is managing the clinic will get the receipt signed by the patients after finishing all the 6 treatments, and they will collect it from a bulk of receipts from 1 month to 6 months. They may collect it, and then they will send it to the insurance companies. And the insurance companies will check if all the treatments has been done correctly, or the dates are correct, the patient name is correct, all these things they will check, and then they will send the bulk sum of money to the clinics. So this is how a physiotherapy clinic is getting money from the insurance companies. Okay, and how do you get paid as an employee? The employees are getting paid based on hour. Per hour, an average physiotherapist may get minimum 18 euros. Okay, and a minimum 1 hour normal German average minimum salary is 12 euro. And physiotherapists, we are getting minimum 18 euros, and average could be 19.5 to 20 euros is also possible. Okay. To understand the universal multipayer healthcare system, there are public and private health insurances. Public is used by both rich and poor people. Used or the in public health insurances, the monthly premium is paid by both rich and poor. But and this contribution is based on the income. Like say, if you are earning 1,000 euro per month, then around 15% or less than that would be your health insurance premium. And if you are getting more and more, your salary is around 4,000 euro or 5,000 euro per month, then it will increase to 18% per month. And after 18%, they won't increase it. You have to fix 18%. Imagine if you are earning more than 100,000 euros as per annum, and in 100,000 euros, what is 18%? So 18,000 euro is paid annually by these people who are earning so much money. But they are not going to use 18,000 euro in a year for their health. So they are allowed to opt to private health insurances. Okay. So in the private health insurances, it is having both high and low premium. Sometimes students who are coming to Germany, they are taking low premium private health insurances, and they are allowed to do it. Students are allowed to do it, and the benefits are also based on the premium. But in the public health insurances, everybody is getting the same treatment. But in private health insurances, those who pay high premium can choose higher benefits. Those who have lower premium can get only low benefits. So this principle is called solidarity principle for public health insurances, and private insurance called equivalence principle. So as of now, do you understand both the principles on how the public and private health insurance works, or do you have any doubts about this question? Or as of now, what you have done? No doubts, right? Okay. As I told already, the benefits are according to the needs. And here the benefits are according to the premium. And here, in case of public health insurance, automatically from your monthly salary, the fee will be deducted. And here, the patients have to pay manually, just like paying the rent to your landlord. You have to pay manually to the private health insurances. And the patients don't have to pay for any medical services. It is completely free except the initial one session. And then here, the patients has to pay all their medical services. And in the public health insurances, cost is transferred by the insurance to the providers. So when the doctor is providing the service, the insurance company is taking the cost and it is paying the doctors. But here, the patient is paying for their medical services, and the insurance company is sending the money when the patient will get a receipt, like a bill from the private practitioner or from the physiotherapist, and the patients will send the bill to the health insurance. The health insurance will deposit the money back to the patient's account. So in case of public health insurance, the money is transferred to the doctor's account. In case of private health insurances, the money is transferred to the patient's account. Okay, and here, in case of private health insurance, the patient is paying the doctor. In case of public health insurance, the insurance company is paying the doctors.